Jenna, do you want me to like introduce it, or are you introducing it?
You can, but of course now this is not wanting to work. Starting live video. Why is it failing? Great. Okay, well, we're live on Instagram. Hi everybody. And we are here with Shannon Wood, one of our nurse injectors. Shannon, do you want to tell everybody watching what you're doing today?
So we are getting ready to do Botox under the arms, and this is for excessive sweating, which is called Hyperhidrosis. It only takes a few minutes to do. Our patient's been numbing. It's on special today. It's a really great treatment for men and women. Lasts about, I would say, 6 months or so, give or take, depends on the person. One important thing to know about this, you will still sweat. That's one question that a lot of patients ask. You will still have some sweating, you just won't have that excessive sweating that you get just, every day, just standing there. If you're one of those people just sweats, this treatment is perfect for you. So.
And now we are live on Facebook as well. So if you guys missed it, this is Shannon Wood. She's one of our nurse injectors, and she's doing Botox for excessive sweating under the underarms, right?
Yes. And feel free to ask questions. We're here to answer those during this time. All right. Okay. Can you see a little bit? So just a few little pinches under each arm. Pretty painless. She numbed for about 15 minutes before. Just little blood.
Can you do this if you don't have excessive sweating?
Yes, you can. If you can do this, it's not going to make as big of a difference, but yes, of course.
Does it hurt?
No.
Did you numb for it?
Yes.
She numbed with our topical cream for about 15 minutes before this treatment.
What's great about this treatment, there's literally no downtime. Probably takes about, a week or two to fully kick in.
The guidelines for shaving beforehand, you can just do it the night before.
Someone said, will this eliminate the need for deodorant?
No, it will not.
Okay. How long does it last? Do we say that?
I would say typically this lasts 6 months, give or take, depending on the patient.
And do men do this?
Yep. It's a great treatment for men. Especially like men who have to wear, if anyone's going to the office these days, like long dress shirts, and they just have that sweating under suits and stuff like that. It's really good for them.
Can this only be done for the underarms? Someone asked if they could do it on their feet.
We, at this practice, we only do it on the underarms.
Does this take the scent away if you were to work out?
It does not.
So you're still sweating,
You're still going to have some sweating, and it does not help with odor.
It's just regulating that sweating.
Yeah.
Some people like to do it before big events too, like a wedding or something similar to that.
So really what it's doing, the Botox, is relaxing those sweat glands so they're not as hyperactive.
And would this make you sweat in other places if it's regulating in the armpits?
No, it shouldn't. How you doing? So as you can see, there's just a few, bunch of little blebs. She's doing great. She's really comfortable. Little minor, pinpoint bleeding, but other than that.
What is the aftercare for this? How soon can someone work out and sweat again?
She could go work out right after this. There's no restrictions to that at all.
Is there any irritation with being waxed or shaved? Do they need to be waxed or shaved before? Can they do either before?
I recommend them shaving before, just so I can kind of see where those little hair follicles are, because that's where I'm going to want to kind of target my injections. I would, maybe avoid waxing just because that can be kind of irritating to the skin. She will be a little red and irritated, but nothing intolerable.
Can she put deodorant on right after?
Yes, she can.
How many units does this typically require?
So this requires, we 50 units, or 100 units,
Mm-hmm.
sorry, 100 units, 50 under each arm. We just dilute it a little bit more than we would for Botox, you know, that we do cosmetically on the face.
But it's a flat fee. It's not like you don't pay per unit like you would for Botox in your face. It's
Right.
just correct.
And today it's on sale for $849. It's normally $1,199. So it's a total of $350 savings.
Yep.
Today only.
Yep, we're done with the arm.
And you might have said this already, but how often does this need to be done?
So typically I would say you would want to do this maybe every like 4 to 6 months, depends on the person. Sorry.
You're fine. You're good. 4 to 6 months, depending on the person.
Yes, 4 to 6 months.
Okay.
Okay, you ready? So as you can see, it's a super quick treatment. You could literally do it on your lunch hour.
And we do numb for this, right?
Yep.
Yeah.
Topically.
I mean, I would say it's optional, but I would recommend it for most patients just so you're more comfortable. There goes the zip.
Yes, you can shave a couple days afterwards.
So this typically costs $11.99, and today
It's $849 today.
$849.
And then not every 3 months for this, typically around 6 months, but it really just depends on the person.
Same questions. So this would be a really great gift for, you know, anyone who suffers from that excessive underarm sweating, or gift yourself with it.
So it says less sweat, less smell. What would you say on that, Shannon?
I would say no. I mean, you might have a little bit less smell, but I would not say this does not, you know, help with odor.
We had someone that was concerned about like nerve damage,
Like if it,
like
this
from
one,
this area. Is that
if
that's
they
not?
have?
No, is it a possibility?
Oh, from Botox?
Yeah.
No. No, this won't cause any nerve damage. I mean, Botox has so many different clinical indications, and I'm injecting this very, very superficially. It's diluted with a really good amount of normal saline also.
Can this be done with laser hair removal?
Yeah.
And then results typically last around 6 months on average. Some people a little less, some people a little bit more. Just depends on someone's metabolism.
Have you seen most patients have success with this treatment, Shannon?
Yeah. It's a, like, I would say it's very high patient satisfaction treatment. Occasionally, I think somebody, you know, I'll have a patient here or there that has to redo it at about 3 months, but that's, I would say most patients get about 4 to 6 months. And those are probably my more active patients, someone who exercises or runs marathons, somebody with a higher metabolism.
And we already said this a couple times, it doesn't help with the smell, it just regulates an excessive amount of moisture and sweating.
Yeah, correct. You doing good?
Doing fabulous.
Jenny, have you had laser hair removal to your underarms?
Yes.
Okay, so a lot of people are asking about laser hair removal and doing this. The person, Jenny, who's actually getting this done, the patient, she has had laser hair removal and she also does Botox for hyperhidrosis. So they are great together.
Yeah, it's actually like that's a really great addition.
Because usually if you have hair under the armpits, it holds more sweat. So keeping it nice and smooth would reduce it in general as well.
And how long should she expect to see the results from like after today? When would it kick in?
So typically I say a week or 2. At 2 weeks she should see her full results. See, feel.
Yep, great for St. Louis summers. If you live in St. Louis, it gets
Right.
very humid here.
That is so true.
And Shannon, what's your experience with metabolism's effect on Botox injections and how long they last?
I mean, it's definitely a thing. I mean, everyone's different. I do find that my really extremely, like, very active patients do metabolize through, you know, Botox and fillers a little bit quicker. For some reason, it just maybe lasts longer on, you know, some patients versus others. I do highly suggest not treating too often, because if you do treat too often or do too many touch-ups too often, you can build a resistance, which we don't want happening. That's no fun.
Can you get it in your hands?
At this practice, we only treat hyperhidrosis under the arms.
And is everyone kind of a candidate for this? Even like everybody sweats. So can anybody get this, or is it just purely for the people who sweat a ton and are always pitting out?
No, that's a really good question. I mean, I've never had this done, and I just kind of sweat normally, but it's something I would definitely consider doing. I have considered doing many times, so I just should grab a provider and do it for me. So yes, it can help with just minimize overall just normal sweating as well.
We've got a good one. It says, is this going to wear off faster the more of an aggressive sweater you are, or is it purely how fast your body metabolizes it?
I would say if you are in a more aggressive sweater, it will most likely wear off a little quicker.
Good to know.
Good question.
Okay. And then does it matter if you do laser hair removal first, or you can do them in conjunction with each other? It doesn't really matter, does it?
I've done laser hair, Botox, laser hair, like
Before or after would
All
work,
of it,
or
yeah.
even during.
during.
So that was it. We're done. I mean, and you can see, I don't know if you guys can see, I mean, she definitely has some like little bumps. Can you see it?
Maybe a little bit.
She has some little bumps, a little bit of pinpoint bleeding. That'll go down in just a few minutes. I'll probably tell her that she could put deodorant on, maybe wait 20-30 minutes or so. But other than that, she can resume normal activity. It'll kick in about a week or so. I was gonna say,
Perfect.
is there another question I didn't answer?
No, I think you got them all. So we are ending right about on time. If anybody's just now tuning in, we will be uploading these to our Instagram and Facebook pages so you can watch them at your own convenience. Hopefully Shannon answers any questions that you have. But if not, feel free to text us. You can reach us at 314-991-5438. All right, thanks for tuning in, guys.
Thanks, guys.
Bye.
Bye.